So good morning and welcome. I'm Sommer Kleweno-Walley. I'm the Interim Chief Executive Officer here at Harborview Medical Center. I am so pleased to be here today to discuss Seattle and King County's efforts to address gun violence. Harborview plays a key role in the community in addressing gun violence. As the only level 1 adult and pediatric trauma center for a 4-state region, we see the tragic results of shootings that take place in our community, not occasionally, but unfortunately very frequently. We have long been involved in gun violence prevention and intervention through our work at the Harborview Injury Prevention and Research Center, led by Dr. Fred Rivara. In 2013, Seattle became the first place in the country to conduct basic gun safety research under Dr. Rivara's leadership. Harborview is currently working with Zero Youth Detention to identify young patients who have been involved with gun violence to enact various interventions aimed at breaking the cycle of violence. I am pleased to have the Seattle Mayor, Jenny Durkan, and King County Executive, Constantine, both who have made gun violence intervention, prevention, and community restoration a top priority. We are lucky to have their leadership on this important issue, and both have made significant investments in this problem. Earlier this summer, Executive Constantine and the King County Board of Health declared June 4th as King County Regional Community Safety and Wellbeing Day in response to the rising rates of gun violence in the region. Under Dow's leadership, a pilot program called the King County Regional Peacekeepers Coalition was established, bringing together many organizations that are addressing these complex issues that drive gun violence in our community. To commemorate these efforts, 2 gun lockbox giveaways events were held in the county. Mayor Durkan has also focused the city's attention on stemming gun violence. In 2018, she enacted city legislation around safe storage of firearms that included increased civil penalties and legal responsibility for failure to report lost or stolen firearms. The city invested $750,000 collected through increased taxes on gun sales and ammunition to help fund gun violence research conducted by the Harborview Injury Prevention Center. On behalf of our employees at both Harborview and UW Medicine, we appreciate our long history of partnership with the city and the county to address the health needs of our community. Recently, from COVID testing to vaccination campaigns, our partnership has shown that it is a powerful one in addressing our community's healthcare needs. I look forward to bringing the same spirit of partnership and collaboration to the epidemic of gun violence we continue to face. Thank you very much. And now I would like to welcome Mayor Durkan to tell us more about the city's recent crucial investment in the Peacekeepers program. Thank you very much.
Thank you very much, Sommer. Thank you for being here. I have to take a moment just to think about, we're here to talk about a public health crisis and a public health response to that crisis. But we also have to remember that being here at Harborview, I want to thank Sommer and all of our frontline healthcare workers here at Harborview and across our region. They saved us through the pandemic. And I just want to thank you for all your work. And we can never forget the special place that Harborview has in our community. I want to thank Dr. Rivara for his work for so many years. But we had to stop for a minute for a helicopter to deliver a patient, which needs to remind us that we are here at probably one of the foremost places in the country that delivers health care. And that's why we're here today, to talk about a public health response to the violence crisis in our community. We know that violence is a result of so many failed systems. And because for so long government has shirked its responsibility, at this moment in time we are called to make investments into healthier, safer communities. There's no magic wand that will erase gun violence, but we know solutions that work. And the first solution is to build healthy communities, to have a public health response, and to recognize the impacts that violence has on community. And at this particular moment of time, as you will hear from the executive who has just been such an incredible partner throughout this and has been focused on this effort for so long, gun violence has hit our community disproportionately. We have seen our communities of color hit the hardest, and particularly African American males. And so many of us participated last year in Black Lives Matter rallies. We have to say today that Black Lives Matter, and we are willing to take a public health response, tap into community, and find the solutions for those communities. That's why I'm very heartened today to announce that the City of Seattle will be investing $2 million in the King County Regional Peacekeepers Collective. It's a pilot program that's brought together a range of community-based organizations with skills, trusted community messengers, lived experience, and the expertise to go in and mentor and help high-risk youth and their families who have experienced the tragedy of gun violence or who may soon experience that, and help break that cycle. With this $2 million investment over the next 2 years, the peacekeepers will have the necessary funding to add restorative services for families, to support specialists for youth, and family support services and comprehensive trainings. Approximately 200 young people and their families will be supported in this using a public health approach and public health strategies. I recently was fortunate to attend one of the peacekeeper trainings, and I witnessed firsthand how powerful those voices are, how hard they are working to disrupt the violence in communities. And we know this work is more important than ever before. But we also know that we have to commit as a region and a city and a state to a structure that will be as enduring in the solutions as the violence has been enduring in communities. And that's what we're hoping with this $2 million grant over 2 years, to be able to help build the structure to support. Look how good they are, right? Talk about support. Thanks, Don. Look, violence is a national crisis. In the last few months, I've had conversations with mayors throughout our country, and we have seen a rise in violence. And it doesn't matter if a mayor is from a big city or a small city, a blue state or a red state. We have seen the violence increasing. And we know some of the reasons and the solutions that work, and today we're here about solutions, community-based solutions. I recently met with the White House with a number of mayors from across the country, and every major city is seeing the same type of uptick. But they lack what we have here. We have, and you'll hear from two people who've been on the front lines for a long time with solutions that we know work, community-based solutions. We want to make sure that we not just tap into that, but we build an enduring framework. We can't deny that firearms are shockingly easy to get and lethal in their endurance. We're having more and more incidents where hundreds of rounds can be fired in one incident. We know that the death rate here in Seattle and King County would be so much higher if it wasn't for Harborview Hospital and the trauma docs here. But each one of the people who is at these incidents, each one of the people who is shot, each one of the families who is touched, causes enduring pain for all of our community. Very complex issues have led to this rise in violence. We know, though, that it comes first from making sure that we invest in healthy, resilient, and safe communities. Making sure that every community has access to affordable housing and good schools and real opportunity, health care. But they also have, working with them, people who can be trusted messengers that they can listen to, who can help disrupt this. Yesterday, we announced $10.4 million in grants for new programs to really get at alternatives and interrupting violence in the city of Seattle. And I couldn't be more proud to be here today to join with the people who have really been looking at how do we build solutions, particularly for our BIPOC communities. We know that the impacts of systemic racism are real, and they impact every part of daily life and have for generations for our communities of color. We will not disrupt that unless we use all the tools we have. So before I turn the podium over to our next speaker, Constantine, who's really been, as I said, a tremendous leader, I also want you to you'll be hearing from people who've been on the front lines. DERRICK Wheeler-Smith, who's the director of Zero Youth Detention, Dominique Davis, CEO of Community Passageways. Each of them have been involved in these efforts for so long. You also hear from Dr. Fred Rivara, who is nationally known for his work on disrupting gun violence. And here you'll hear from Chief of Police Adrian Diaz, who really has built his career as a police officer, working with community and finding those community solutions. So with that, I'll turn it over to our County Executive, Constantine. I could not ask for a better partner in these and the other efforts we've been making. Dow?
Well, thank you, Mayor Durkan, and thank you to everyone for being here today. This scourge, this epidemic of gun violence affects us all. And stopping it means that we all must work together, and that is what the peacekeepers are about. This summer, we've already seen a heartbreaking surge in gun violence around our county and around our country. And we know that interventions that place people and communities first are the kind of interventions that are integral to stopping this pain. Now, that's the thinking behind the work that we've been doing, the thinking behind our work to tackle gun violence as the public health crisis that it is. Using data-driven approaches, we can identify individuals, identify those who are at the highest risk of gun violence, and we can coordinate individualized interventions and wraparound services to reduce the risk of violence in our communities. Public Health, Seattle and King County, and the Peacekeepers Collective, and now together with the city's investment, will build the solutions to curb gun violence. Street outreach programs, hospital-based interventions, group violence interventions, violence interruption, crisis management. Our approach with community-led solutions has also led the White House to select King County, along with 14 cities, as part of their collaborative to reduce gun violence across the nation. Now, ending gun violence isn't a dream. It is a reality, a real possibility. We can't wait for someone else to step in and make it happen, though, someone else to solve it. This is the team that can do it. And this is the moment when we are compelled to act. So the work of the Peacekeepers Collective and the county, and now the city, will have real-world results and will save lives and prevent harm. There really cannot be a nobler pursuit than ensuring the lives of our friends and neighbors, ensuring the lives of everyone in this community can be free of gun violence. And that is what we are setting out to do. So I want to thank Mayor Durkan for the city's partnership, for this new investment in our gun violence prevention work, for the leadership of our healthcare community, and thank you, all of you, from Harborview and elsewhere, our healthcare leaders who are here with us today. And to our folks from Public Health, Seattle and King County. As the mayor mentioned, I mean, this has been a long haul the last year and a half, and we have plenty to do just on the COVID pandemic, but we have other pandemics that we must turn our attention to as well, and gun violence certainly among them. And I am looking forward to continuing our work to ensure that everyone in King County has the opportunity to thrive. That is our core mission. That is our true north. Making this a welcoming community where every person can thrive and thrive free of the threat of gun violence. Now I'd like to introduce two leaders who are helping in our community effort to make that happen. Derrick Wheeler-Smith is our Director of Zero Youth Detention, and Dominique Davis is the CEO of Community Passageways. Gentlemen.
Thank you, Executive Constantine and Mayor Durkan. We are taking huge steps in the right direction to make the kind of investments that are going to be important to be able to sustain this work that we're doing. We're really holding two tensions. What do we need to do to stop our kids from dying tonight in the streets? While also thinking about how are we creating the conditions in community that allows for equitable quality and quantity of life. That is critical. Otherwise, we have organizations that do amazing work around violence intervention, but then they're forced to send young people back to the same environment that made them sick in the first place. And so today we are doing the work of employing strategies focused on targeted, trauma-informed care. And interrupting cycles of violence can produce life-saving and cost-efficient results in a short period without contributing to mass incarceration. Now, I'm a former teacher, and so I'm used to being in the classroom, and if I have to raise my voice a little bit to, hey, I need you in the back, sit down there, I still got a little bit of that in me. So one thing that is important is that as we treat this disease of violence, we have to make sure that these violence interrupters, who are really a new kind of public health worker, out in the streets, risking their lives, literally ducking bullets, that they have the best tools, that they have the best education, and that they have the necessary resources as we get the vaccine out into community. And one such worker is Dominique Davis, founder of Community Passageways, who's a part of this Regional Peacekeepers Collective that's doing this important work of intervening, stopping the violence that's happening, but then also making sure that we have the relationship-based resources to support young people in a continuum of care, that we can bring them to a place of health and wellness.
I'm excited today. I'm excited because I'm seeing progress being made. I'm seeing the ball rolling in the right direction. We are getting investments, we are getting attention, people are getting focused on addressing this pandemic of gun violence that has been plaguing our community for decades, right? Everybody focused on COVID, which it needed to have a focus on, but all of a sudden resources, a plethora of resources just came out of nowhere to address COVID at a very high level, which was very much needed. And everybody here did a good job in King County and the city on addressing COVID. But we still were struggling with gun violence. And the uptick of gun violence now has got a bigger focus now. Now it's made people shift their focus from other issues in the community to say we have to stop this, the gun violence that's happening right now in our space. Our kids are not safe. Our families are not safe. Our community does not feel safe. We ask our young people, why do you guys feel like you have to carry a gun? They kind of laugh. They're like, what do you think? We all know the answer to that, right? How do we provide an environment that is safe for our children, that is safe for our families? And so this is an opportunity for us to collaborate like we're doing right now. The county and the city are doing a great job putting some investments in, and it's open up the door for more investments to come, for more attention to be on it, to a bigger focus to be on it. Because what we're gonna do is we're gonna stop gun violence. My team, myself, we're on the ground, we're boots on the ground. We're dealing with this trauma every single day. We have to deal with this trauma. This trauma is tearing our community apart. The crying mothers, the grieving families that we have to deal with, and the trauma that we take on doing this work. So now investments are being made, which makes us feel like you guys see us. You guys see what's going on. You guys are putting in a focus and some attention on this. And now we're excited that this is happening. The collaboration of the system stakeholders, county and city, along with the community stakeholders that are doing this work, coming together and holding each other accountable and being responsible together for the answer of gun violence. Now it's just not the community having to put it on their back and solve the issues that racist institutions have put in our community. We don't have to do that no more. We are working with the institutions that are saying we want to solve this problem. So now the collaboration is powerful. This funding that's coming down the pike is going to put us in a position to be able to hire the people, train the people from the community that have been traumatized by the violence, have been through the legal criminal justice system, have been through these issues that we face in the community, and they get to be trained up, get a good living wage, go back into the community, and use their influence to start pulling young people and families together and out of this perpetuated violence that keeps happening. So I appreciate being here. I'm excited about the collaboration. I'm excited about the resources and the funding. And I appreciate you guys having come here with these cameras and focus on us so we can talk about this. Thank you.
Dr. Fred Rivara.
Thanks very much. There's been a lot of attention in the last few months about racial disparities, and particularly the racial disparities related to the COVID epidemic, who got sick and who died. But those racial disparities pale in comparison to those racial disparities related to gun violence. It is our young black men, our young Hispanic men, our young Asian men who are at greatest risk of gun violence. Our previous speakers have mentioned how Harborview is involved with very many parts of addressing the gun violence problem. I want to talk with you briefly about the kind of research that we're doing to help contribute to reducing the burden of gun violence. One of the things we're going to be doing is working with the partners in the community and here at Harborview to evaluate the effectiveness of these intervention programs that are being developed today and mentioned today, to look at, are they intensive enough? Are they addressing the right kinds of people? Are they addressing them with the right kinds of interventions? We're also looking at various interventions that have been developed here in the state. The state of Washington is now one of the leaders in legislation to address the gun violence problem. For example, we're one of 19 states that has the red flag laws, extreme risk protection orders. We're looking at the effectiveness of those and how effective those are in reducing gun violence problems. We're working with the King County Prosecuting Attorney's Office, who has one of the best units in the country for trying to get guns out of the hands of domestic violence abusers. We are working with the trauma centers across the country to look at the number of non-fatal firearm injuries that occur each year. We don't have that data currently, but we are trying to develop a big surveillance system across the country in trauma centers to collect that information. We also have promoted safe storage of firearms, both here in the city as well as around the state. We've developed a map of law enforcement agencies and gun dealers and gun ranges that will take temporary possession of a firearm in homes where there's been a crisis to try to prevent firearm homicides and suicides. So we see research as an important part of trying to eliminate gun violence and reduce the burden of it in people's lives in the community. Thank you very much.
Good afternoon, everyone. And thank you for everybody here that's focused really on addressing gun violence. The simple thing is the violence has to stop. It's simple as that. Our city is experiencing the highest number of shots fired in our history. Just a few weeks ago, we had over 24 shots fired in a single week. Even with diminished resources, our officers have been exhaustively working each and every incident of gun violence. We put this level of work into these kind of events regardless of whether somebody is hurt or killed, because every incident of gun violence is an assault against our community. Each and every shots fired brings trauma to our community. It affects our ability to feel safe. This year alone, we've already recovered close to 2,000 shell casings. And when someone is injured or killed, we are all impacted. Each shooting has very real impacts to our community, our medical system, our legal system, and our first responders. Not to mention the emotional costs that are undermining our collective opportunity to thrive. I'm thankful for Mayor Durkan, Executive Constantine, and the other folks here that are invested in making a difference. It is true we need to work together to fight this violence. For months, our department has worked regularly with local and federal partners focused on solutions. We've been conducting investigations, which recently we recovered over 50 guns and over 19 search warrants. We must stop people who are preying on our communities. We are on pace to recover another 1,000 guns this year alone. We need to make sure these guns aren't in the hands of people wanting to do harm to our community. we're working with other agencies to test each of the casings and guns recovered to see where it is being used. And from these various investigations, we know that guns used in Seattle are not only being used in King County, but as far as Portland. We tried our best to shed light on the surge of gun violence. When our officers recover an illegal seized gun, when one is used in Seattle, we push that information out to the public. But we can't accept this as a norm for Seattle. Today, we're unveiling our new public-facing shots fired dashboard. Just head to seattle.gov/police. You will see a link to our citywide shots fired and shootings. You will see that there's a 40% increase in shots fired this year compared to the same period last year. We've seen a more than 100% increase in drive-by shootings this year alone. While I'm proud for our folks building the site out, their final product nearly knocked me off my feet. The numbers don't lie. This is a gun violence crisis. As police officers and public servants, we can't do everything. We must all band together to keep our neighborhoods safe. We need to keep the firearms safe. We need to report if they're stolen and report gun violence when it happens, instead of relying on our hospitals and our emergency rooms to call when people are arrived after they've been shot. Together we can all come up with a solution. And thank you.
I'll try to MC questions for me or for anyone up here. I want to start with who's got the first question. Yeah, the question was, what will this funding be used for in terms of hiring staff? It's a combination of things. When I went out to see the peacekeepers, it's like any array of nonprofits you've seen with a very strong mission. But what was evident is they were in a small room, coming together, disparate people, and they didn't have the support or structure to make sure that this could be durable. And so sitting down with DERRICK and listening to what is it they needed over time that they could build this out and build on what the county's been doing and we've been doing, it was clear we needed to provide $2 million to bring that structure together so there would be a period over time that they knew they would have what it took to run this. And so I'll let DERRICK talk a little bit more if he wants about what the money's going to. But really, I think one thing we need to take away from this is there is no quick fix. We have got to take steps that are going to be over multiple years. If we want to create generational change, we have to commit to efforts for a generation.
Thank you, Mayor Durkan. We absolutely will need long-term and sustained investments over time to be able to get the kind of results that we need to see. There have been decades and decades of divestments in some of these communities, and as a result, there's so much fragmentation that a large part of the work of the regional peacekeepers is really to move us away from the isolated approaches that have been taking place where an individual organization might be funded, but they go and work in isolation. You can't solve these kinds of complex issues without recognizing the interdependence that we have across our different domains, departments, and how these things all intersect to work together. And so we're really launching a comprehensive plan and strategy that can address these things. So when we think about funding, I feel like I think I'm a helicopter magnet or something. Like, as we think about these investments, you have to think about, I mentioned this new kind of public health worker. So we've got violence interrupters. So we've got violence interrupters. These are folks who are credible messengers that have relationships in community, who can make these connections because they have these relationships with young people and with some of the folks who are in most imminent danger in relationship to violence. There's life coaches, right? Those are two completely different roles. There's case management that has to happen. We have to ensure that services are following the young person. We're funding an interventionist role here at Harborview, as was mentioned, as we're looking at a comprehensive strategy that intersects trauma, the social determinants of health and violence, and how those things all connect and work together. And so there has to be an infrastructure that's built up that allows this work to be able to go forward. Otherwise, it's like building roads and pathways that never connect. And so we're intentionally looking at what does a continuum of care look like? How are we building out an ecosystem that allows each of these organizations along this continuum of care to bring the best of what they do to the services to be able to make the kinds of shifts that we need in community. So hospital-based interventions, group violence interventions, violence interruption and crisis management, individualized wraparound services. Those are many of the things that these resources are going to support.
Thank you, Derrick. We have time for about 5 more questions, I'm told, and we'll keep the answer short. Omari.
Yeah, Mayor Durkan, first of all, I think this is great. Converge, this has been a consistent beat drum for us for the last few years we've been on air. Good to see all these cameras that are out here talking about this very serious issue. Ma'am, I think that in our coverage here, when we talk about actually impacting people and making a change, as far as the city, like the city getting behind this, I have you on camera saying that if a lot of this gun violence was happening in northern Seattle, in other areas, you might get a buy-in of a whole city that's actually going to care more than see this on the evening news and walk away from it. Also, King County Council member Gurmai Zahalai has also said that, like, hey, we need to approach this like we did COVID-19, and we heard our colleagues here on say that earlier. What is it that the city is doing, especially because city council is so quiet on these murders that are happening and everything else? What can the city do? What can your office do to really, be honest with you, ma'am, make people in this city and county care? Because a lot of times these gunshots that are occurring and these murders that are occurring aren't happening in other neighborhoods, and because it's not in their neighborhoods, people don't care. What can your office do and County Executive Constantine do to really get everybody behind it? We had the hashtag, we got this Seattle. How can we get everybody on board to fight gun violence and be supportive of gun violence disruption?
Thank you, Omari. This is one of the first steps we have to do. As you know, look, we need a vaccine against violence. And if you want to ask me what the vaccine against violence is, it's some of the things and programs we've looked at. It means every mother has good care and health care before she delivers a baby, that every kid has access to good quality pre-K and safe schools. They can go to college. They have access to jobs and opportunity. So we have to build that infrastructure. It's like Dom said. It said it doesn't do any good to interrupt the violence if you have to return people to the same ecosystem. So I want all of Seattle to be in this in the same way. This is about us and our city. Last year, we had an unprecedented number of people from every part of this city stand up and say Black Lives Matter. We have to show that it's true, and we've seen this gun violence disproportionately affecting the Black community. Over half the victims are African American. So we will do this. We have to do it together, but it has to be holistic. Next question.
Mayor, question for you and the chief as well. This rising in gun violence comes as we as a society are kind of reevaluating the role of policing. How do you feel that these gun reform bills may impact either negative or positively, the stemming or the attempt to stem gun violence?
I think what you're seeing today is we have to take all approaches. We know that we cannot police or arrest our way out of this violence, or we wouldn't have it. And that's why we need these peacekeepers, these community-based organizations. There are incidents when police are the response and play such a crucial role in public safety. But we also know that we have to fund those things that actually make a community safe and resilient in the first instance. You want to add to that?
No, I was supporting exactly.
Yeah, I have a question for Chief Diaz or perhaps Derrick and Dominic. You know, in your work out in the field, talking with people, you were saying how there needs to be trust established, right? And over the last year, we have gotten a sense that community trust for policing has faced challenges. Do you experience that in the field, and how does that impact the police department's role in trying to help solve this problem?
Yeah, we know that there is a divide between law enforcement and community nationwide, right? And we just witnessed that through 2020 at a high level. This is decades of this system has been having challenges with community, right? The legal system has had challenges with the community. So now where we're at now is here in Seattle, right, with Adrian, Diaz, Chief Diaz, we have been able to build a collaboration and relationship with them to where we have a clear understanding of how we both operate in the community. right? And so how we operate in the community is something that we've come to an agreement with. I'm saying that in a way where supporting the community is what we do as a community, and we're working with law enforcement for them to support the community in the way that community does. They still have to do their job, and we don't get in the way of that, but the community has its priorities first. We have to take care of each other first. We have to deal with our issues and the systemic issues of racism and the things that law enforcement have perpetuated in our community for decades. So we're dealing with that. This is a long-term thing. There's no quick answer I can come to you with and say, this is how we're gonna fix it. But I can say, starting to build the relationship so that there's a clear understanding of this is how our community needs to be served. Resources is what we need, resources.
No, I couldn't agree more. I've worked with Dom and a lot of the different organizations for years, that relationship it also needs healing. That relationship needs for us to build trust. We're already doing reconciliation sessions with community. We're already doing a variety of different listening sessions to understand the community dynamics of mistrust in police. And so we are trying to figure out ways that we can heal with the community. But we also have a task where we have black and brown people that are being shot and killed every day. And so we've also got to figure out how do we come together to support each other, to figuring out how we can support our youth to be able to thrive. And that's what we're committed to doing right now.
Do you feel the support has improved since last year?
I think, we're standing here today. I think that's been a positive way of how we move forward over the last year. I think that we as a department are really trying to change our structure to ensure that there is funding for these programs, because it is so important. Police will respond. That's how we make things, address public safety and immediacy. But we need these programs to really support and address other issues that are going on in the community that police don't have that time.
All right, I want to thank everyone for being here, and just want to say again, going back to what Amari asked, I'd ask everybody in Seattle, when you hear that there's another shooting, don't think about, oh, there's another shooting. Whose kid was it that got shot? What mother's been touched? Who in the community? We know that right now between 18 and 27 is where the violence is happening most, and we've got to interrupt that violence. But we want every kid who's 2 years old and up today to not have to need those violence interrupters. What I want to see is DERRICK and Dom out of business. I want to have a city where that isn't needed anymore. I want a city where some kid right now in South Seattle is owning the rocket company 20 years from now. Thank you very much.